So once a family has a diagnosis of autism, we think about two separate pathways. One is what sorts of services will your child benefit from? What kinds of services are you going to ask for? And the second piece is how is all of this going to be covered? What kinds of state services is your child eligible for? What kind of insurance coverage do you have? So coverage for services for children with autism can come from several different manners. The first is if a child has commercial insurance, the family should call their insurance company and find out what kind of services are covered with a diagnosis of autism. In general, most insurance companies have a list of services that are covered and a list of services that are not covered. That at least is empowering so that you know when you go to providers that a service should be covered. The next is that for children with more significant impairment, they will qualify for services under the State Division of Developmental Disabilities, frequently referred to as DDD. The process for receiving DDD services is that you take your full evaluation that you've received from an approved provider to DDD or send it to them, and they will review that to make sure that they agree that yes, everything has been done appropriately to make the diagnosis of autism. That qualifies your child for entry into the DDD program. However, in order to receive actual coverage of services, the child needs to qualify for a program within Arizona called Arizona Long-Term Care System, ALTCS, ALTCS is how you will see it written. The process for being approved for ALTCS is that you're first enrolled in DDD, and then a provider from DDD will be sent to your home, and they will ask you a list of questions, and the name of this questionnaire is called the Pre-Admission Screening Questionnaire, sometimes referred to as the PASS. During this questionnaire, when you're answering questions in this questionnaire, you receive points, or your child receives points, when they have difficulty performing certain age-appropriate tasks. If your child receives enough points on the PASS, they will qualify for DDD ALTCS, and then many different services, including speech, occupational therapy, and behavioral therapies will be covered by the state program. Another way that you can receive services for your child with autism is if you have access. Our access system, which is our state Medicaid program, does cover services for autism if they are considered medically appropriate. And so if you do have access, it's very important to go to your primary care provider in the access system, and they can authorize the services needed for your child and help you decide where to receive those services within your community.